Coming up on Healthy Living, find out the symptoms of a heart attack and when to call 911. Then we'll learn about a new approach to open heart surgery that means a smaller incision and shorter recovery. Plus some tips to start your own journey to better heart health.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at SMDC.
Good evening, I'm Michelle Lee. Welcome to another edition of Healthy Living, brought to you by the experts at SMDC. Tonight we're discussing a topic that's close to my heart, maintaining our heart health. Find out what to do if you're having a cardiac emergency and how to prevent a heart attack in the first place. Let's begin tonight with Dr. Al Deibele, a cardiologist with the SMDC Heart and Vascular Center. Thank you very much for joining us tonight, Doctor. First off, what are the symptoms of a heart attack?
The classic symptoms of a heart attack are a pressure-like sensation or a feeling like an elephant is on your chest. It may go down your left arm. It may make you feel short of breath and a bit nauseated.
And that's what they consider the Hollywood heart attack.
Exactly.
Now, do all people have these classic symptoms?
Actually, it's only the minority of people. Only about 40% of patients have the classic symptoms of a heart attack.
Okay, so how are women and maybe the elderly a little bit different in this scheme?
Women and the elderly will often have what we call atypical symptoms, in other words, out of the norm. Heart symptoms can be anywhere from about the belly button to about the level of your ear. And it can be a burning-like sensation. It can be any type of discomfort that's out of the realm of normal for you.
Mm-hmm. It could be maybe a back pain or shoulder pain?
Back pain, shoulder pain, arm pain, wrist pain, jaw pain, ear pain, a burning in the throat. All of those are possibly cardiac symptoms.
So it's possible that women might be having a heart attack but just think it might be heartburn, and then they don't go in and they might have had a mini heart attack.
Exactly. So that's why it's very important to make sure that you take seriously any symptoms that are really not normal for you.
Are there any symptoms that should not be ignored?
Really, it would be, again, symptoms are out of the normal for you.
Mm-hmm. Now, another thing that women or men, and oftentimes heart attacks happen during the night. So a lot of people, well, I'll just sleep it off, or what should they be doing? Don't try to sleep it off.
No, exactly. You really need to take symptoms seriously if they last more than 10 to 15 minutes, because that's really the time that you can prevent heart damage from occurring in the first place. If the heart doesn't get blood flow for approximately 15 minutes, heart muscle starts to die and then you form scar tissue.
Mm-hmm. So some people might think I better drive myself to the hospital. What do you think of that?
That's not a good idea at all. When you have a heart attack, you can end up with rhythm problems and the heart can actually stop. So you really need to call 911 and have an ambulance bring you in. So you have trained health professionals that are able to deal with some of the complications that can occur with a heart attack.
Mm-hmm. What about the people who might be reluctant to even go into the emergency room thinking, oh, it's probably nothing?
Well, again, you know, we have seen people who like to say, well, it can't be a heart attack, it isn't hurting that bad. For example, I've even heard people say, well, I did push-ups, so it can't be a heart attack. And you don't want to stress your heart further if something is actually going on like that. So if the symptoms don't resolve after 15 minutes, it's best to get it checked out.
Mm-hmm. So once we get into the hospital, what do you offer at St. Mary's for emergency heart care?
Well, we start with care in the emergency room, so you'll receive oxygen by a cannula going in your nose. We'll put an IV in. We'll give sublingual nitroglycerin. You may get nitroglycerin intravenously. We'll often use some pain medications to help relax you. And then we'll start the evaluation.
Okay. Let's talk briefly about some of the trends you might be seeing. Are people getting healthier?
Actually, if you look at the trends and what's happening, you see younger and younger people being heavier and heavier, so that people are developing diabetes earlier in life. So the risk factors actually are increasing rather than getting better at this point. So the coronary disease is something that we're seeing at younger and younger ages.
How can we prevent heart disease from beginning, or a heart attack itself?
It's really pretty simple, and it's a heart-healthy lifestyle is the way I like to put it, and that involves a whole lot of things. It's exercising on a regular basis. It's eating healthy, not too many fats or not too much salt in your diet. It's not smoking. It's making sure that your blood pressure is under control, maintaining all the things that you have control over.
Mm-hmm. Things that our parents have told us for many years, that we need to take care of ourselves. But we need to start doing it.
Exactly. It's, there's more than a grain of truth to what your mother had to tell you.
Okay. Thank you very much, Dr. Deibele. We appreciate you visiting with us tonight.
Thank you very much, Michelle. Okay. My pleasure.
All right.